Welcome to Unfiltered Talks with Shehnaz Mirza. I am Shehnaz Mirza, and with me today is Dr Priyanka Poomani, a board-certified pediatrician and a passionate child-focused orator. She has been an international keynote speaker at leading global pediatric conferences and has contributed extensively through articles, journals, and rare case reports. Beyond her professional life, she's a vocabulary enthusiast with a love for words and enjoys scuba diving and chess in her leisure time. Welcome to the show, Dr. Priyanka.
It's my pleasure, Shehnaz. Thank you for having me here today.
There are a lot of first-time mothers who actually struggle with how to care for their newborns. What is the kind of feeding? Should we do it around the clock? Should we do it when they cry? What is the kind of care in terms of the temperature, the care in terms of bathing, wrapping them, putting them to sleep? There are a lot of things that always they're confused with. So that's the reason I wanted to have this episode, mainly so that we are able to give this information to these first-time mothers. So to get started, now, when a baby basically tries to communicate through her cries, we know that. But is there a way that we can understand initially in the earlier weeks or days, why is the baby crying? How can I as a mother, a new mother, come to know what is the reason she's crying?
As you've already said, crying is a sort of communication, and it is the modality of communication for any neonate especially. As all of us know, a baby who's like less than 28 days old, we call it as neonate. And it is a biologically adaptive signal for a neonate to convey her unmet needs and physiological distress to her parents. And it is the accountability of a pediatrician to observe with an empathy as well as clinical insight and expertise to rule out the possible causes of the cry. And when it comes to cry, we could group it into two. We could classify into two. That is, number one is it could be physiological, more of behavioral related. And second could be pathological. That is more of any underlying ailments or organic causes and mostly pain related. When it comes to physiological, the most common cause is hunger cues.
Correct.
And second comes your sleep deprivation, and your third comes about the insect bites, and then any wetty diapers, and any
discomfort basically.
Yes.
Okay.
And any over exposure to sensory stimuli, like your overexposure to light, your noise, and all that.
Okay.
Or it could be when she is in requirement of any emotional support, like she needs to be cuddled, she needs to be pacified, all that. It could be grouped into behavioral or physiological. And on the other side, we have some sort of pathological also.
So for hunger, I believe, when the baby is hungry, is there a cry that we should able to, or what should we do when we realize that maybe the baby could be hungry? Maybe it's a hunger cry.
Here you have two things to do. Like you can identify the baby's crying with two reflexes.
Okay.
That is, number one is rooting reflex.
Okay.
For example, if you have your little finger at the angle of the corner of the mouth of the baby, she'll be turning her head towards your finger. And then she will start to suckle your finger. This is called as rooting reflex and sucking reflex.
Okay, I've seen that sometimes when you put that hand and they keep twisting their head towards the hand, thinking that it is maybe the mother trying to feed, or maybe it's a feeder bottle or something come to them. Okay.
Yes, this is a sort of primitive reflex. It usually appears by birth and disappears at around 3 to 4 months.
Okay.
Yes.
Okay. And then besides this, you said if the temperature has to be a certain level, not too much noise, I believe.
About the temperature or thermoregulation, it's very essential for us to keep the baby with appropriate clothing. Like you shouldn't overdo it or underdo it.
Okay.
Because there are cases when we have seen mothers who have not covered the baby with proper clothing and in the detents and all that. They'll be exposed to a lot of cold environment, and then they will ultimately lead to hypothermia. Hypothermia then leads to hypoglycemia. Hypothermia is less temperature. That will lead to less sugar levels. That will ultimately eventually lead to your fits, call it as seizures.
Okay.
So it could be a small act of concern or care, which often we neglect, will eventually lead to serious issues.
Yeah, okay. I never knew that this could be a cause for fits or something, and this is this is information to know. Now, besides that, also besides the crying and everything, overall, to keep the baby wrapped, you said that we should know. So if the baby is uncomfortable, then we know that maybe it's, he's trying to toss out the clothes or toss out something, just to kind of understand that, yeah, now he's or she's uncomfortable. Will he like pull on the clothes or something? Because how will I know that now the baby is crying because the clothes are bothering the baby?
You can't expect any aggressive cry from the baby because of the clothing.
Okay.
It's highly not possible. It's
maybe we can check the temperature to see that, yeah, if the body is extremely then she's feeling hot or she's sweating, the baby is sweating. Are these things that we can look out for?
You can look for any pathological causes. That is mostly seen through persistent inconsolable cry, as you have been saying. I think you're talking about that persistent inconsolable cry.
Yeah, sometimes when they just cry, they are shrill, the eyes shut and they have their hands and we don't understand what's happening. So we could check for the temperature at that time.
We can check for the temperature. Yeah, if at all the temperature is more than 100.4 Fahrenheit, that is around 38 degrees Celsius, then it is sort of like febrile response for the baby. And here you could suspect the toxicity of the baby through 3 things. That is, number 1 is inconsolable persistent cry. Second one is going to be a refusal of feeds. And number 3 is going to be your lethargy.
Okay, so when we have these 3, it means that it's not the food or the temperature, it is she's unwell. There is an illness. Then you have to check with the body temperature to see if there's no fever or there is any other ailment. So then I think the time for the baby to come to you.
Yes.
Okay. Besides that, now also just wrapping the baby and keeping, because there are a lot of myths that keep the baby wrapped, like that's how they feel in the womb. Is that also true in terms of wrapping it? And also bathing. I was told that bathe the baby every day from day 1. So these things, what should one do?
As per any pediatrician, we are not supposed to bathe the baby from day 1. You will have to wait for the umbilical cord to self-fall. And the umbilical cord falls somewhere around 7 to 14 days, between this range. Okay, the umbilical cord gets dried up, gets shriveled up, and it falls. And it's after the umbilical cord falls, then the the pediatrician will be advising the mother to give the first bath for the baby. And it usually happens at around like 7 to 10 days, something like that.
So even a sponge bath in the first week?
Yeah, sponge bath can help,
but not then complete water.
Yes, yes. And that too, while you give your the first bath and the bathing for the first couple of days, you will have to make sure that you use some sort of like chemical free all moisturizer, soaps and shampoos.
Correct. Okay.
It's very
now
essential.
The wrapping up and also the sleeping positions.
Sleeping positions, it's highly essential for each and every mother and parent and a caregiver to be informed about this. You will have to put the baby on prone position, that is at the back. The back has to face the couch or the crib, wherever you're going to place the baby.
The back has to be
yes.
flat. Okay.
Because here I could say about a scenario which is called as sudden infant death syndrome. All of a sudden you will be you won't have any reasons or warning signs. The baby must have been fine, but then still there is a mortality, a specific mortality because of this SIDS, like this sudden infant death syndrome. It's because you tend to over dress up the baby, or else it could be because of the overheating of the baby. The baby might be going for elevated temperature, that is hyperpyrexia. And then, or else if there is any parent who's like smoking in the premises and all, that may also lead to
choking or something.
Yes. And the third one, you shouldn't overcrowd the couch or the crib wherever you're placing the baby. You will have to place the baby in a fitted mattress, like a flat mattress. And don't crowd the crib with all the soft toys and all the rattles and all that. Okay, and the pillows and all that. And one more thing, you have to share the room with the baby, but not share your bed with the baby. Never ever allow your baby to sleep with you.
Maybe you could just put your hand and suffocate.
Obviously.
The baby will just be struggling underneath the weight of it and not come through.
You got it right. You got it right.
Wow, okay, that's news. I mean, I did do that of putting my babies next to it. I was a very light sleeper, so I would wake up. So luckily my 3 children are alive, nothing has happened to them. Lucky for me. Okay, Now, besides these diapers, we have this, sometimes we don't know they're crying and okay, we were told that, check the diapers and change them. So in terms of diapers, in terms of hygiene, what is it that regularly we should be on the lookout for?
When it comes to diapers, it's one of the second common cause for any behavioral cry for the baby. Like if at all, if there is any wetty diaper or soiled diapers, because of the moisture content from the fecal matter, the baby will be irritated and it will start crying. So it's highly essential to have a check and change the diapers regularly and often. And when it comes to urination, micturition and defecation, there are lots of things which we'll discuss. Like the baby has to urinate at least around 8 to 10 times per day. Correct. And you will have to check for the diaper change at least around 8 times per day. Correct. So if you leave it aside, then the baby will get irritated, and it could be one of the most common cause, and then there'll be a lot of rashes. Correct. In the perianal region and all that. So you will have to have a check on it regularly.
Okay. Now this is all the do's and these symptoms that we know. Coming to a very important part, mothers always like to feed the baby to make him fat, and they all even the baby doesn't want to feed. I've seen that, okay, at a very small, tiny age, no, but at later ages, I've seen them forcefully feeding babies. In terms of nutrition, what is it that we should do? What is it that we should not? And what is the requirement of babies at various stages?
Nutrition. As you said, lot of mothers are very concerned about the weight management and all that, and then they tend to overfeed. Correct. Feeding, food is something nice, right? We are all very passionate about food. Correct. And when it comes to feeding the baby, it has to be done with love, passion and care and hygiene. That's what I believe. That's what every pediatricians believe all over the world. And regarding nutrition, the mother has to feed the baby within about 30 minutes of its birth. As soon as the baby is born, we'll have to keep the baby with the mother, that is skin to skin contact. Correct. So that, as I have already mentioned about hypothermia, you can prevent the baby from getting hypothermia. And that is where the emotional bond between the child as well as the mother increases, and then the mother will be able to pacify her baby and breastfeed the baby. Okay. And it can be done within about 30 minutes of the baby's birth, as soon as possible, so that the baby doesn't end up having hypoglycemia. And every day, for the first 7 days, you can have a little bit of weight loss from the birth weight of the baby, because you will be having all that water content and everything from your in utero. When you're exposed outside, you will be having that loss of water, the deficit. So that's pretty normal, so you don't have to worry about it. It's highly essential to counsel the mothers about this also. And right from day 14, the baby will start to gain the birth weight and they will start to increase. And it's actually the duty of a pediatrician to monitor the weight as well as the range of weight, everything. Like it has to be around 15 to 30 grams per day until first 6 months. And regarding nutrition, exclusive breastfeeding is the most prominent thing which we used to counsel all the mothers as well as the parents.
Okay. There were times where I was told, so it was it's a lot of confusion back then. 4 months is only breastfeed, 6 months is breastfeed. So it was very confusing whether it's 4 months that we should do breastfeeding, is it 6 months, and then to give extra nutrition in which month? Somebody said, no, 3rd month you can start, 4th month you can start, 6th month. So the top up or the extra other feed that you give out, external food, when do you start that and till when? Okay, you said 6 months, that's good to know. So when do you start the other feed, and what are the kind of feeds that we can give babies? What are the kind of foods we can give them?
Exclusive breastfeeding until 6 months.
Okay, done.
Exclusive EBF until 6 months. No spices, no honey, no grape water, no sugar. People used to give a lot of things but then you're not supposed to give anything. Not even cow's milk. I have seen a lot of cases when these babies end up having cow's milk protein allergy, and they used to have bloody stools, abdominal distension, and there are lots of cases where I have seen they end up having shock and ultimately death also.
Okay, in case if the mother is not able to feed for whatever reason, she's not getting the right amount of milk or whatever reason, what is then the second option at that stage?
If she's not able to get the milk, then you can go for any fortified formula milk.
Okay.
But then again, we have two things. If the mother is a preemie means she's giving birth for the first time. Or she has already given birth. That's the thing.
Previously.
If she is going to be a preemie who has not given birth, then you can wait up to 2 to 3 months. 2 to 3 days. It at least takes around 48 to 72 hours for her lactiferous glands in her breast to produce milk. And at that time, it's highly essential for every pediatrician and the nurse to promote non-nutritive sucking. See, you won't get milk, but then still, because of the sucking, you will be able to produce milk from your glands. So we often say to promote non-nutritive sucking for the first couple of days, and then eventually she will be ending up to have a milk.
There is one more myth, I don't know if it is true or not. They say that the mother has to have a lot of fluids, juices or water or milk. Is that true? Or is
that could be contributing factor,
okay,
just an add-on support.
Okay, not the main reason.
Yeah, obviously, like you will have to have healthy food and all the green leafy vegetables and possibly all those lentils, legumes and all that from your side. Like that is going to have a contributing fact on your production of milk.
Okay. And I think they also say that those lotus seeds, that ones that puff, those, they're called makhane in the Indian subcontinent. Is that a very great source of getting the mother's milk, or is that just a myth, I think?
I have no idea. I have not spoke about it.
Okay, no worries. And the other thing I wanted to know, other kind of foods, say after 6 months, what is the other kind of foods till a year and a half, till the time he gets at least, starts eating proper food that we are eating on the table. What is the other kind of nutrition?
Yes, after 6 months. First 6 months is going to be exclusive breastfeeding, and you will have to breastfeed for at least 18 months, 1.5 years to 2 years.
Correct.
And with this, at 6 months, you will be introducing a sort of like semi-solid food, which is called as complementary foods, or you call it as, this practice is called as weaning. This complementary food is going to be introduced at 6 months because as the baby grows, all its muscle mass will be increasing, your musculoskeletal maturation will happen, and there is going to be a progressive increase in your anthropometry. Your anthropometry is your height, your weight, your head circumference, your muscle mass, your body mass index and all that. So it's highly essential for a pediatrician to have a check on this. So if you end up having only your breast milk, you won't have any nutrition. Your nutrition is all about your balanced diet with carbohydrates and your proteins, your fats, your vitamins and your minerals. So it's very appropriate for you to introduce all those kinds of food, a balanced diet at the age of around 6 months. So it could be, the consistency of this food is very important. It has to be something around like semi-solid. It has to be some sort of like puree based. Like for example, it shouldn't be so liquid. If you drop it on your spoon, it shouldn't be so liquid or so solid. Some sort of little bit chewy would be fine. It could be your mashed potato, it could be your dal and rice, it could be your cooked potatoes, or it could be your mashed carrot and all that. And some green leafy vegetables, overcooked.
Yeah, I got that. And at some stage, I was also doing that, but initially it was a complete, back then when I was a mother, it was complete chaos, because sometimes they would say, give them dal water. Sometimes somebody would say, give them some juice. Take any orange or something, dilute that, give them that. So for the first child, I was completely confused the whole time long. By the time I had my second, I had some idea, but not still a lot. But by the time the third came along, yes, as you said, the mashed potatoes, the rice with yogurt, those things were what I would ideally give the babies, and that would help. So can we do all that like in the 4th, 5th month? No, introduction of juices and dal water, and dal is lentils for those who don't understand. Lentils, the water of that, nothing of that sort.
We don't recommend. because
Okay.
after 6 months your digestive system and everything will be some sort of like matured, so you will have to wait for that. So it's highly imperative for us to note the allergies also. Okay,
Correct.
the baby will be having the threshold, if at all, if you give cow's milk or something else after 6 months, you will have to each and every food whatever you introduce,
Check.
it could be egg or anything, you will have to have a check on the allergy for at least 72 hours. Some of the
Correct.
kids may be allergic to
Correct.
eggs.
Yeah,
Some of
yeah,
them
yeah,
would be allergic to beef or meat or something,
yeah,
whatever you give.
yeah.
So the threshold will be very less until 6 months of age. So it's highly essential you restrict it after 6 months.
Okay, got it. Now, in terms of meat, fish, chicken, if the baby and the parents are non-vegetarians, of course, they will introduce that. So when is the meats, when are the chickens, the fish, when is this to be introduced? Which month? Maybe 9th, 10th or 1 year or something?
This is called as finger foods, one of the part of complementary foods.
Correct.
First it starts from mashed and then some sort of like semi-solid,
Correct.
and then we used to have some finger foods and then family foods. Okay, finger foods is some sort of like cooked potatoes and scrambled egg and all that you can give. This is something from a small portion of a family food. You can give, I mean, you'll have to check about its the cooking level and everything. It shouldn't be overcooked or undercooked. It has to be bland, some sort of like bland, not with high spices, not with high salt or sugar. So it's highly essential you start it from 10 or 11 months. It would be fine.
Okay. So now we've understood what the mother should do in terms of feeding. The first 6 months is breastfeed, you said, and later on we can have top-up foods, especially like the mashed vegetables and things like that, and 9, 10 months, 12 months is the meat. In terms of the timings, in terms of the regularity of feeding, what is it that the mother should worry about from the beginning, the first few months, and then later on the other foods?
When it comes to nutrition, we have a vast knowledge about it and we can explore a lot of things. Coming to newborn, I'll start off with newborn. It's highly essential for a mother to feed her baby every 2 hourly, because at least around 10 to 12 times per day. You have got 24 hours and you will have to feed at around every 2 hourly, so that you end up feeding at least like 10 to 12 times per day. And then each and every time you feed, you will have to make sure that the mother empties her first breast and then ends up emptying her breast once, and then after 2 hours she can use another breast, because we have got 3 components from a breast milk, that is colostrum, where you will be getting all the immunoglobulins, and that is going to prevent your baby from a lot of diseases at the later stage of your life. It could be your persistent recurrent ear infections, which we call it as otitis media, and then we also get the baby prevented from this diarrhea and more of respiratory tract infections. It's all because of this immunoglobulins.
So basically, yeah, the immunity builds up because of this colostrum.
Colostrum,
okay,
yes.
And then the other 2 layers of the milk.
Then we get the fore milk. Fore milk is the thin consistency part of the milk, where you will be able to nullify only the thirst of the baby. Okay. And then once if you give this fore milk after the baby passes urine after 1 or 2 hours, then it will again, it will start crying for hunger. And it is highly essential for you to wait up to the hind milk, which is, it's consisting full of your dense caloric food, all the nutrients and everything. So it's through this hind milk that the baby will be able to nullify its your hunger.
So if you only feed for the first and second part, the fore milk will only the thirst. It will not, the baby will not get the right nutrition.
Obviously.
So it's necessary to go deep and to continue for that 2 hours, so that for the process takes around how much time?
You'll have to wait for at least, each and every breastfeeding session has to be at least around 15 to 30 minutes.
30 minutes.
Okay, some people, I've seen a lot of ladies, a lot of women, mothers, like they feed for just 5 to 10 minutes and then they end up saying, okay, I'm not getting milk and all that, and yeah, I have fed the baby. But no, you will have to wait for at least 15 to 30 minutes for your one session to be completed. And then you will have to put the baby to sleep, and after 2 to 3 hours, then you will have to feed the baby with another breast. You will have to empty the breast.
Got it.
Okay. And every day we'll be having a note of the baby's weight also. So it is highly essential that the baby weight increases up to 15 to 30 grams per day. For the first 7 days, it's okay, no problem, because you'll be having all that water content and everything from your in utero. And once it is expelled out, obviously it will be exhausted with all that water content. And up to 7 days, a little bit of weight loss is okay. It can be managed. But then, if it is going to be persistent for more than 14 days, then you can try to rule out. You can suspect any organic cause. And mostly for a normal baby, it tends to gain its birth weight at around like 14 days. And there is going to be an increase in weight within about more than 15 to 30 days.
Okay. And then later on, after 6 months, when the baby starts eating other kind of foods, that in a day, 5 times, 6 times, what is the kind of mix that we should give? Timings, how often should we feed the baby with foods? Or is it advisable? Because sometimes they say, don't give breast milk then, give it just once, or give it just when you sleep, the whole day you give it food. Is there a right way to do it also? And if there is, what is it? Otherwise, it's just as per the baby per se.
Up to 6 months, it's all about your exclusive breastfeeding. You're not supposed to give anything else, neither your grape water, anything else. We have seen conventional practices where we used to give a lot of supplements and all that, grape water and all. But we don't do it. We shouldn't do it. Even cow's milk also we're not supposed to give until 6 months of age. Because I have seen cases where cow's milk has introduced cow's milk protein allergy, because of which the baby has ended up having bloody loose stools and abdominal distension, fever, and then it has eventually led to the death of the baby due to shock and dehydration. But then after 6 months, you can introduce your semi-solid food for the baby. That is the complementary foods. That is usually done after 6 months of age. And you will have to maintain your breastfeeding also, but then maybe your frequency could be less because you have started giving complementary foods for the baby. And this process is called as weaning.
Weaning.
Yes.
Get the baby off the breast milk and
yes,
start
gradually and progressively.
Okay.
And then regarding this complementary foods, we have got a lot of examples. It's very essential for you to feed your baby with love, passion and care and hygiene, of course. Never ever force feed your baby. Yeah. So a lot of examples could be there, like your mashed, pureed potato. It could be your your lentils and legumes with rice. And then it could be your porridge, it could be your oats, some green leafy vegetables which is like overcooked. You can try giving the baby. And the scrambled egg can be also given. But each and every time you introduce a new food to the baby, it's highly imperative for you to have a check on the allergy for at least around 48 to 72 hours.
Okay.
Maybe if the baby is having an allergy towards the egg, you will have to stop it there.
Okay.
And this complementary feeds has to be introduced in a very gradual way. Like you can start giving at 6 months.
Okay.
First, you will have to give your mashed and pureed foods, and then comes your finger foods. Whatever you eat, you can give a little bit of it. Some cooked potatoes, not a mashed potato, but you can give some little bit of cooked potatoes. And then comes your small portion from family food. For example, if at all you eat your chapati and your soft dal, you can soak it in the dal and give a little bit. Maybe you can give.
So that way, basically, you're introducing the foods to the baby, and the baby gets a taste of it also.
Yes.
Okay.
Yes.
The bottled foods that we have, the Gerber babies and the Cerelacs and all, is it advisable to give that, or preferably not to give that?
It's a lot of corporate people have been doing that, right? We have been doing conventionally, and obviously we have a lot of fortified vitamins and minerals. So now world is like mechanical, right? Although there are a lot of working mothers and all that. So
yeah, for the convenience and ease, it's okay. If
purpose.
she's at home, then it's better to maybe cook up something.
Obviously.
And then give the baby.
No harm in giving, but then ideally we can wean off from these practices, I believe.
Okay. So the American Academy of Pediatrics recommends that a daily vitamin D supplement is to be given. And I remember when my firstborn was little, he was diagnosed with rickets, and I didn't know that. I went first time home, and my mom picked him, and he was 5 months something, and he was not putting any weight on his leg.
He had his bowing of legs.
Crumbling, yeah. When he stood, he was just wanting to flop, not put weight. And then she said that go get him checked. And then I took him to a pediatrician in Bombay, and they said that he's got rickets, and then there were some injections to be done. So now the vitamin D supplement, and as the American Pediatric Society also recommends daily dose, what is it that we can do to prevent babies from rickets? What is the kind of regular vitamin D dose? Take him out in the sun. What do we do?
We make it a point to give vitamin D supplementation from the 3rd day of life. In India, back in India, it's highly imperative that we discharge the babies after getting them started with vitamin D. And each and every day we give around 400 international units. That is the dosage which is recommended by IAP, that is Indian Academy of Pediatrics, as well as American Academy of Pediatrics.
So taking them out in the sun, would that help, or we have to give them a dose?
You will have to give a dose.
Get a dose.
You will have to give that. That's just one drop. That you'll be giving just one drop of that medicine every morning. Every morning.
Okay.
And it is to be continued up to 1 year of age, completion of 1 year of age, 12 months. And after 12 months only, the baby will be able to take up to 32 ounces of milk. Until then, he'll be able to take only up to 8 ounces of milk. So after you introduce 32 ounces of milk, then only you will be able to give adequate amount of 400 international units of vitamin D to your baby. So it is highly essential you give your supplementations until the completion of 12 months of age.
Okay, got it. Now we'll move forward. So we've learned what nutritional factors, how it impacts the baby's growth, and how do we, feed them from time to time. Coming to certain kind of illnesses, certain kind of ailments that we see in the baby. Maybe he's got jaundice at early age, there's a runny diarrhea, there's a cold, there's a cough, there's a earache. These little things are very common in babies. What is it that a mother should look out for?
When it comes to babies, when you talk about jaundice, it is more common in newborn cases.
Correct.
Like we call it as physiological and pathological jaundice. If there is going to be your blood group incompatibility, that is going to be a cause of pathological jaundice. Or if there is going to be any liver disorders, that is going to end up having pathological jaundice. Or if there is any blood disorders, like we have thalassemia and all that, hereditary spherocytosis and all, that is all pathological. Let's not panic the mothers about talking about the pathological thing. Let me be very common. Like its physiological jaundice is mainly because of inadequate breastfeeding. So it's highly essential for each and every mother to breastfeed her baby timely, so that she could prevent the baby from having physiological jaundice. And if at all, if this jaundice is left unnoticed and untreated, we have got 2 modalities to treat jaundice in the newborn setup. That is, number 1 is you give your phototherapy. You keep the baby under the light and all that in an intensive care unit. And second one, if at all it is resistant to phototherapy, then you start transfusing your blood, exchange transfusion. That is called as double volume exchange transfusion. So all this is happening. So if you leave your jaundice untreated, that can affect your brain. And progressively that is going to lead to some sort of like neurological decline, and the baby will be having some CP and a lot of mental issues at the later stages of the life. I don't want to get into a lot of things about it. And regarding diarrhea, the more and more you feed your baby, the more and more you will be able to prevent your baby from getting diarrhea.
Right.
Because breastfeeding has got a vast number of advantages, protecting your baby from diarrhea, your respiratory tract infections, and repeated urine infections, as I've already mentioned, your otitis media. And the baby who's breastfed is supposed to have 8 times of more IQ than the baby who's not breastfed.
Wow.
And then the breastfed baby has a good dentition than the baby who's not breastfed.
Okay.
So lots of things are there.
Okay.
So regarding diarrhea, the more and more you breastfeed, the more and more you'll be able to prevent your baby from getting diarrhea. If at all your baby gets diarrhea, it's highly essential for you to maintain all those hygiene practices.
Right.
And at that time, you'll be giving zinc ORS, that is oral rehydration solution, and some sort of like probiotics, that is Bifilac and all that we'll be giving.
Okay.
Probably this zinc will be continued up to 14 days.
Okay, all right, okay. So lucky for me, I was able to, for my second and third child, I was there feeding, but the first baby, for my firstborn, 6 months, and then I was not able to because I was expecting my next child at that time. So anyways, That was good to know that it affects the mental development also for babies. And besides that, also we see sometimes babies common cold and cough and earache and these things. So before they get it, we rather have something to prevent it. Is there any way that we can be always alert to prevent them from getting into this kind of cold, earache, fever, cough and this kind of the flu basically?
Common cold, flu and all, like from my point of view, the more and more you get your flu and everything, your baby will be exposed to all that, and then at the later stages of your life, maybe they'll be able to have the threshold to fight back. So common cold and flu, it's seasonal. You don't have to worry about it. All you can do is that you can you can have your preventive vaccinations beforehand, your prophylactic vaccinations, and then you can manage them symptomatically. For example, if they have flu or some common cold, you can treat them with your paracetamol, and if your fever is going to persist for more than 3 days, irrespective of your paracetamol and everything, then you can go for your blood investigations and all that.
Now that you mention about vaccines and immunization, we all know that there are certain set vaccines that a child, a baby, from the time he's born to the time he's maybe 4 years, need to be given regularly. But we still see that a lot of mothers, maybe in our subcontinent area, they do sometimes neglect that. So what are the repercussions? Like, of course, we know in terms of something like polio, now there is more awareness, but maybe 3-4 decades ago, there wasn't a lot of awareness. Are there any other vaccines as such now which have really strong repercussions, and parents or mothers have to be very aware that yes, these have to be given. There's no escape from that.
When you talk about vaccinations, I would like to say something about the iceberg. So you'd have seen the tip of the iceberg, okay, in the ocean. See, the tip of the iceberg is all about what you have eventually read, all about the diseases, all about the infections and all. And the submerged part of the iceberg is something which you have not diagnosed. It could be your non-communicable diseases like diabetes, your hypertension, your hypercholesterolemia and all that. So when you have the tip of the iceberg where it is composed of your communicable diseases, infections and your deaths regarding all those neglected things, why can't you prevent all those with your vaccinations? So it is highly essential for each and every mother to strictly follow the vaccination schedule. It could be national immunization schedule, or it could be from the WHO or whatever. When it comes to vaccination, at birth, right, we are the pediatricians, right, we used to receive the baby, we used to resuscitate the baby. At the resuscitation tray itself, we used to give vitamin K, and then within about 24 hours, we used to give BCG. BCG is that vaccine which prevents tuberculosis.
Correct.
And then obviously you'll be having it in a left arm, right?
Yes, the mark is there still.
Yes. Sometimes you'll be having a sort of like induration and edema and all that, crusting and all that. That's maybe, and you'll be having some abscess, and you'll be symptomatically managing all that. And then comes your hepatitis B vaccine, and then comes your OPV, that is oral polio vaccine, and then comes your DPT, that prevents from your pertussis, your whooping cough, your tetanus and diphtheria. And then comes your MMR vaccine, that is your measles, mumps and rubella. Yes. And then comes your, it's with MMR you get to have your vitamin A as well. And then comes your TT, now TT has become TD, okay, in India, back in India. And then you have your HPV, that is human papilloma virus, that is more of adolescent type vaccine. So you have, then you have got typhoid vaccine, that is oral as well as injectable also. So if at all, if you neglect any of this, like hepatitis B, it is one of the triple markers. Like when you go for HIV testing, even for the adults, they used to check for hepatitis C and B also. Because it is highly prevalent nowadays. And when it comes to diphtheria, whooping cough and everything, it is all highly communicable and contagious. If you don't give the vaccine, it is going to end up having its own
repercussions.
Yes.
Now, in terms of the care after the vaccine, I remember my babies would have swollen thighs, it's red, they're getting fever, and for days, not only it would be red, it would be hurting, it would be hard. And then some said that put a hot compression, sometimes they would say that. What is the best care in those times that the baby needs for that area, first of all, and also overall to pacify the baby?
Any vaccination, after you get the vaccination, they'll be having a small sort of like monitoring period, maybe 15 minutes or 30 minutes, to report if there is any adverse reactions. So if the baby is fine, then only they'll allow the baby to go out of the premises. But if at all certain vaccines exhibit their side effects quite after a long time, maybe after a day or a two, at that moment maybe you will have to symptomatically manage. The first one is pyrexia, that is your fever. Like you can give your paracetamol. And then if there is going to be any localized reactions like your swelling and your redness and all that, if there is any sort of things, then you can try giving cold compressions. And if it is resistant to that, and if your baby starts developing that abscess, induration and all, you will have to seriously report it to the vaccination center. That's all you can do that. And then they'll take care.
Okay, great, fabulous. Now we'll move on to other household environment and how we can keep the baby safe, the safety from a lot of things, from falling, from injuring themselves, hazardous substances. What is the kind of care that we should be alert for our babies?
When it comes to the babies, forget about the newborn babies. They have their own spectrum of problems, but then you will have to pay attention to the toddlers because they are the ones who are like able to walk
all over the place.
Yes. When it comes to infants, I've already told about sudden infant death syndrome. I would like to add it on again. Like you will have to have a flat, firm mattress for the baby. Avoid overcrowding with soft toys and your rattles and everything in the crib. And avoid sharing your bed with the baby. It will end up having asphyxia and strangulation. That's the thing. And avoid smoking in the premises. That's what you will have to think about the babies who are less than 12 months of age. That is infancy. When it comes to toddlers around like 1 to 3 years of age, then you have to be highly aware. You will have to be highly conscious that you don't have any small hard substances like choking substances like marbles or pebbles, as they will swallow it up.
Beads and little things that may be
coins,
that they will just eat.
Yes, and any sharp objects, something like that. And always store your containers with actually what it is meant to be. Like some people say, like I've seen a lot of cases, toxicology cases, a lot of small kids, they used to have a lot of medicines and all that. I've seen cases where the baby used to go and drink paracetamol syrup and it ends up having paracetamol poisoning and comes to the emergency department. And then we tend to give its antidote, which is called as N-acetylcysteine. So make sure that you have all these bottles away from the baby.
Correct.
So keep all the cleaning agents, chemical agents away from the baby. And always never ever leave a baby alone. And never ever leave a baby alone with her sibling. You know the reason.
You don't know,
you know the reason. I read somewhere, like 2 days back I read, like I heard somewhere that a 6-year-old boy had kept his small sister around 8 months old into a micro oven because he was highly jealous of his parents giving a lot of attention to his sister, it seems. So that was like, oh my God.
Oh my God. Oh my God. So, well, luckily for me, nothing like that so drastic happened. But yeah, I do remember one incident where my son came from school and one kid in school chopped off his hair in the front, and I went and I complained. He was just barely 3 and I put him in KG1. I complained to the teacher. She was pretty apologetic. And she, said sorry that sometimes he's busy at one corner, and he just went to the table and grabbed it. I said if that scissor could have pierced the eyes. But then what my son did, he came back home and after a day or two, he chopped my daughter's hair. And then I realized that, of course, accidents can happen. He can grab the scissors somewhere and he, chopped it off thinking, okay, let me do the same because I was done with this treatment. So I will give it to my sibling, so something like that. But yeah, it could be sometimes we are busy but ideally, as you said, keep away all the items of, sharp objects and beads and the disinfectants, keep them away in shelves locked. That's right. And not to keep siblings alone ever. Yeah, you're right. Yeah. So now we've seen mostly what are the do's, don'ts, what should we do in terms of feeding, immunization, moving to mental development. Now the babies, from the time they are born, I believe that they need to be engaged there needs to be some activity, and we do see mothers a lot of times making silly noises, voices, and reaching out to their babies. What is it that one should do? What is it the best that the mother should do so that they also let the babies, keep them engaged, as well as the babies learning something?
Well, you talk about this. I would like to make a note of 777 rule. Okay. That's composed of two things. That is, number one is developmental rule and another one is play rule. And when it comes to developmental rule, 777 is all about your 0 to 7 months, where your child needs, your baby needs a lot of emotional support from you. That's a time it will be literally yearning for a lot of nurture as well as your care and concern and love. So it's highly essential for you to have a skin-to-skin contact with the baby, nurture your bond with the baby and spend a lot of time. You can cuddle the baby, you can literally like proceed with some sort of like gentle voice modulations and all that. When it comes to 7 months to 14 months, and then you can proceed with some sort of like showing small color toys, some building blocks and all that. When it comes to 14 months to 14 years, I'm talking about 14 months to 14 years. This is all about your adolescence period is also involved in this, where you will have to teach what is right, what is wrong to the kids, you know. That is the time adolescence is more of, you know, they are the future investment for our society later. They are the most vulnerable population. And when it's going to be more than 14 to 21, that is where you will have to encourage all those strategical thinking, critical thinking and decision making. So this is something which is called as developmental rule. Based upon another 777 rule, it's highly essential for each and every parent to spend, number one, that is going to be 7 minutes per day. That could be a small like listening to music, or it could be like reading a small story, a book or something like that. Just 7 minutes per day with your kid.
Now, as you mentioned the 777, it's great, you know, I believe parents should not just spend 7 minutes. Parents, if you have children who are little, who are toddlers, who are babies, we feel that they don't need you. They need you, believe me. And you will not get those golden years. They may turn to be 18, 20. That's the time they require you less. Of course, they need you for different things, for guidance. But as a mother of 3, if you have toddlers and babies, please be with them, because one, they will not get those, you will not get those golden years again. And the bond you create with them then will last a lifetime. So this is for all parents. From a mother who's mother of 3, 21-year-old, a 20-year-old and a 17-year-old. Now, the question that I wanted to ask you basically is, so we do see that a lot of mothers try to keep their babies engaged with some activities. They make some faces sometimes, they read sometimes. What is the best kind of thing that they should do at that stage with babies in the early years? And are there certain things that they are not ready to take, being toddlers, or things that they can do later on?
It's highly essential for a mother or a parent or a caregiver to highly have a knowledge about the developmental milestones, the domains of developmental milestones. It's broadly classified into 4. That is your gross motor, your fine motor, your social and adaptive, and your speech and language. When it comes to gross motor, I mean, your question is more about social and adaptive and speech and language. So we'll start off with gross motor. Like there is a specified age when the baby can sit with support, sit without support, stand without support, stand with support, start running, start walking. And when it comes to fine motor, as you say, like there is a lot of curriculum, Indian curriculum especially, when they are really very much bothered about starting and teaching the kids to draw, to write and all that.
Yeah, I have something to say there. I remember when my son, my firstborn, was 3-year-old, he could say his ABCs, he could say his 1 to 20 in English, in Arabic and in Hindi. And he had memorized a lot of nursery rhymes. So at age 3, I thought he was ready for school. And the school said, no, we take at 3.5, we cannot take. But I insisted that he's ready, take him for school. But the class teacher, when I met her for the first time, she said that his finger dexterity is not developed. I think that's what you're mentioning about the second part, the fine motor skills.
Yes.
And she said that will be difficult for a 3-year-old child. And our Indian curriculum, you know how rigorous we are. We want the child to hold the pen and the pencil from day one and start writing as if we're all going to make them writers and authors. And till today, he has an okay handwriting, but he says, Mama, my bad handwriting is because of you. So now, in terms of this motor dexterity, what are the things that he learns in the gross? What are the things that he learns in the the fine motor skills, if you can classify that in a layman's term?
True. When I've told about gross motor, it's all about sitting with support at 6 months.
Correct.
And then sitting without support at around 9 months, standing with support at around 10 months, and standing without support at around 12 months, maybe the first birthday. And I remember I started walking during my first birthday party. I still used to get amused when I see my video. And after walking for like around 2 to 3 steps, I used to fall. And then then the baby used to run at around 15 months of age. And when it comes to your fine motor, you have that unidextrous grasp and bidextrous grasp. Your bidextrous grasp is all about trying to fetch the object with both of your hands. Unidextrous is where you need only one hand to fetch your object. So first you will get your bidextrous, then as your age progresses, then you will end up having unidextrous.
Okay, so what age is that when we're looking at by the two hands? What age is that they do that, and then what age is that when they want to do the one hand?
Bidextrous is around 6 months and unidextrous around 8 months.
Okay.
And the baby will be able to transfer objects from one hand to the another hand at around 6 months.
Okay. So as you mentioned that there are these gross skills and there are the fine motor, there are other two also that you have to talk about.
Speech and language.
Those? Yes.
Speech and language is all about your cooing. When you get cooing, the baby starts cooing at around 3 months of age. Then it happens to give its monosyllable, that is ma, pa, at around 6 months of age. Then comes bisyllables, mama, dada, at 9 months of age. And at 3, he will be able to say his name, his father's name, his mother's name, whatever you teach him, and his age at 3. And at 4, he'll be able to say rhymes or poem or whatever you say.
That's why I know that they normally in schools they say bring him at age 4. They don't take at an early age.
Could be because
I believe that they want them to be at least able to say or speak or fluently speak. And but in my case, I do remember at age 3, most of my children, they had all the skills. Not that I was forcing it on them, that learn this nursery or but rhyme or so, but they picked it up.
Could have been spontaneous. It could have been organical. You don't have to force, right?
Yeah. They would just pick
Kudos
it up.
for that.
And then there is one more you said, social and
adaptive.
Adaptive. Yes. What is that?
At 2 months of age, the baby will be able to reciprocate for the social smile. If at all you're going to smile at the baby, he will smile at you back.
Okay.
At 2 months. And then at 3 months, he will be able to recognize his mother. That is called as mother recognition. And at 6 months, he will be able to notice the stranger anxiety. And at 9 months, the mother can play a peekaboo. The baby will be able to reciprocate for that. And at 10 months, if you're going to wave bye, he will be able to wave you bye again. And then at 3 years, you can start playing with the kid. He'll be engaging into a parallel play. And at 4 years, it is going to be a group play. He can sit, he can play with a group, with his peers, with his friends and all that. So this is social and adaptive.
This is how they develop. Okay.
Yes.
But you just mentioned that to recognize the mother, he would do it in 2 months. The first 2 months, he doesn't know that this is my mother?
No.
Wow, that's heart-wrenching, no? He just thinks there's a lady taking care of him?
He may know the warmth, he may know
the touch.
The warmth and all that. But then to recognize him, to recognize the mother, it takes around 3 months. I was talking about the social smile at 2 months.
Okay.
It takes around 3 months, at least 3 months. For him to recognize his mother.
For him to sink in that, okay, this is my mother.
Yes, this is my mother. Because
then he knows that this is somebody who's caring and giving you warmth and comfort and all that. but the mother. Okay.
Yes, even stranger anxiety comes at only 6 months, because you'll be having a couple of visitors who's going to come and visit your kids, but then he won't be cranky with every one of them. Even when the dad picks up the child, he'll start crying. Whenever the mother picks up the child also, he'll start crying during the first few months of the life. It's only after 3 months he'll come to know, okay, this is my mother, and after 6 months he'll be coming to know, okay, this is someone else outside the house. It's some sort of like stranger.
Okay,
Yes.
okay. I believe there's so much more that I'd like to discuss, but I think for this episode we can close it there, because we were looking at the early years, the years that they are babies, and at the most 2 years. But definitely we'll like to have you back, and then we talk about the adolescence years, the teenage, the youth, and things that happen in their social environment that maybe affects them, and maybe health issues and other concerns as well. So it's been wonderful talking to you, Dr. Priyanka. Thank you so much for such an insightful session. I'm sure the mothers out there and all our viewers learned so much today. Thank you for being a part of this.
It's my pleasure to be here, Shehnaz. I wish you all the best for your future episodes. Thank you so much.
Thank you so much for being a part of this episode, and we look forward to seeing you in the next episode. This is Unfiltered Talks with Shehnaz Mirza.